apologize for this, but this has been a day that started very early, and I've not really had a chance to visit the restroom. So I'm gonna take just a moment break. I'll be right back, and then we're gonna go right to questions. We'll do it in just a minute.
Could I ask one question?
No, wait a minute. We're gonna wait.
Well, these people weren't allowed to speak against the public option. They were given all the time they wanted. Could we have someone speak in favor of the public option?
Wait till he comes back.
Okay, but I think the public option should be given as much time as they can.
Straight back there.
You can speak.
Now or when you
No. Coach, whatever. What you want me to hear?
I don't want to say anything. Because I do want to hear.
Quite agree with me? Got little Maylocks on board? Good to go. Sir, you make a very good point. I did not know what these people would say. We don't pre-screen what anybody says. I think in fairness, if you'd like to make a statement on behalf of public option, that'd be fair.
I appreciate you going for true democracy, and I've been a supporter of yours for a long time. I think there's been a tremendous amount of distortion that goes on when you're trying to get healthcare information. There's a lot of subtle stuff, like what happened right here. Nobody speaks on behalf of the public option. There have been distortions by people like Sarah Taylor. I think if everybody in this room would take the time to do their own research, they'd find out some very true, frightening, and shocking things. I'd like to start by talking about two girls from Hazen. My daughter, Megan, she's in New York. There's another girl, I won't name her, she went to school with me. I'll talk about the girl in Hazen first. She's 30 years old. 30 years old, and guess what? She's bankrupt. What bankrupted her? The same thing that bankrupted 60% of the bankruptcies in the United States, healthcare. 60% of the bankruptcies in the United States are caused by healthcare. This doesn't happen in Canada, Germany, France, and so on. Where's the United States ranked in preventable deaths? 19th in the world. This can't go on. This business about we can't have a public option. We can't have a public option as long as people listen to Rush Limbaugh, Fox News, and all that. We can have a public option if you go home and do your homework. I have Blue Cross. It's cost me $821 a month. I walked into the RV park in Hazen the other day. There were two Canadians there. Struck up a conversation with them. They about fell out of the chair when they found out what I was paying for my health care. And I asked them, how do you like your health care? They're from British Columbia. They loved it. They said that they couldn't believe that I pay that much a month. They pay $400 a year. So there's a lot of people who want you to think a certain way for a certain reason. And I, frankly, Senator Conrad, I'm concerned. I voted for you, and there are a lot of young people who worked hard. I'm pleased to see the young people are getting involved in this. Young people worked hard to bring change to this country. One of our biggest obstacles of getting change in this country is lobbies and the healthcare lobby. And as you know, Keith Olbermann, your good buddy on MSNBC, he called you out on this, but I believe you're ranked number 35 for taking money from the healthcare lobby. How can I expect you to serve me when the healthcare lobby is serving you? If the insurance company goes out of business, if we have fewer insurance companies, I'd venture to say your campaign contributions are going to be down. But I'll sum up by saying this. You have had my vote, and you've had the vote of a lot of young people, a lot of people who support progress in this country and who want real progress. I did leave one part out of this. That's my daughter in New York. She's trying to start a business. She has no health care. She's healthy. She's on the verge of getting her business going. She can't pay for health care because she's trying to start a business. The only person who could pay for it is me. If she gets hurt, I could be liable for hundreds of thousands of dollars. Okay? That doesn't happen in any other country in the world. The fact that young people can't get health care in this country stifles business. Her only choice is to go to work for somebody else. That isn't creativity. That doesn't make business go forward. Now, you have two young people. The girl in Hazen, 30 years old, bankrupt, has a colostomy bag hooked to her. She can't get taken off because she's bankrupt. there's no excuse for a country that allows, she's a good kid too, let me say that, she went to school, she did all the right things, but she's bankrupt. Back to political philosophy. You can side up to the right, and you can think you have it made in North Dakota because you take the left for granted. But I think what's going to happen in North Dakota, I want Democrats, I elected a Democrat, that's what I want. I want a Democratic president. But you can't, when you get down and you say, when they ask you what you want for dessert, you only get one dessert, you have to pick one side or the other. But I think if you move to the left, or to the right, I should say, on this healthcare thing, I think you deserve to lose the support of people on the left. You can't have both ways.
In 2008, the country voted for change in a big, big way. We elected our first black president. We gave the Democrats in the House of Representatives a 70-vote majority, and for the first time in my memory, we have a filibuster-proof 60 to 40 Democratic lead in the Senate. Now, the 60 votes is really significant. If you remember all the battles through the Bush years, every time something contentious came up, one side or the other would threaten to filibuster. You need 60 votes to stop the filibuster. The Democrats don't need the Republicans, even though they have extended the olive branch and tried to work with the Republicans on several options. They don't need to. If we could just get the public option on the floor of the Senate for debate, I'm asking if you will vote for cloture and let the public option be debated on the floor of the Senate. I'm really kind of disappointed that you were so quick to fracture that 60-vote block in the Senate with your own plan. You know, I watched the Republicans for 8 years. Whether an idea was good or bad, they were behind it 110%. They were like a bullet out of a rifle. And every time the Democrats have an idea, I don't care how good it is, it's a shotgun and it's going all over the place, and we don't seem to get much progress. I'm asking you if you will vote for cloture, if it comes to it in the Senate, and allow the public option to be debated on the Senate floor.
Well, first of all, I appreciate your passion. We, in fact, don't have 60 votes. I know people think we do, but the fact is we have 2 senators who are sick who are not voting. So that takes us to 58. We've had...
Collins and Snow.
Excuse me?
We have Collins and Snow.
Well, they're not Democrats. You just said we had 60 Democrats. So we don't... Well, let's look...
60 votes, Senator.
Look, you said Democrats have 60 votes, so they don't need Republicans. Now you're talking about Republican votes. Which is it? Which is it?
It really doesn't make any difference.
Oh yes, it makes all the difference in the world. Facts matter. We do not have 60 votes. In addition, 3 Democrats have said they would not support public option beyond me. So now you're at 55 votes. 55 is not 60. So the reason I was given the assignment to come up with an alternative to try to bridge the differences, because if you really believe you want to expand coverage, you want to contain costs, then you have to pass legislation. If you want to pass legislation in the United States Senate, you got to get 60 votes. We don't have them. We won't have them. If you want to end this entire effort in failure, just keep on this course.